From KETK, you're watching East Texas Live.
Welcome back to East Texas Live. We have Dr. Peter Karagosian here to talk about non-opioid pain management treatment. How are you doing today?
I'm doing well, David. Thank you for having me.
Yes, sir. So first, can you just tell us about your approach to, pain management?
Of course, yes. So as a sports medicine physician, I work with Christus. I'm at the Orthopedic and Sports Medicine Institute on South Broadway. And so we have a lot of patients coming to see us for various different joints and tendon-related pains. And so being able to provide them different options for pain relief has been helpful. And hopefully this tool that I'll be discussing with you today will help kind of diversify some of that for patients.
All right. First, can you just tell us a little bit about this device?
Of course, yeah, I'd be happy to. So this device is called iovera. Pacira is the parent company that's kind of developed this tool. And so for a lot of situations where patients have been having pain and we're trying to minimize steroid injections or we're trying to minimize opioid use, this device uses basically a nitrous oxide cold canister, and it supplies cold treatments to nerves to help with pain. And so this has been very helpful in particular for knee arthritis pain and shoulder arthritis pain. This device, you basically insert the canister into the back portion of it, click it in, and at the tip of it is a small trident needle that basically is kind of like a tattoo needle. It goes just deep to the skin. And so as we scan through your nerves with an ultrasound, it helps apply cold treatments to help with pain.
Yes, sir. And so if people have questions about that, how do you kind of explain this to the patients?
For sure, yeah. So the biggest thing is there are different types of nerve treatments. One of them is called an ablation, which a lot of the interventional spine or pain management doctors will do, and that's essentially where they burn the nerve. This is an alternative approach that basically temporarily freezes the nerve. And so often patients will get a number of months of pain relief of very different consistencies depending on how bad the arthritis or the pain is. But this device has been able to help temporarily freeze or stop pain for a period of time. And it has no steroid use. It doesn't have all the effects on blood sugars and blood pressures that a lot of steroid medications have. So this has been very helpful to treat patients' pain.
Yes, so who would be the main benefactors of this?
Right. The biggest things as well, I have really two subsets of patients who will come to see me. One of them is if they're having pain in primarily their knee or their shoulder is where we use this in general. For a chronic pain that's been going on for multiple months, this has been helpful to kind of calm down some of that pain. If patients are trying to not have to do surgery, or even so, if they're trying to help with their post-operative pain before surgery. And so I'll have some patients come see me to do this procedure a few weeks in advance of their shoulder replacement or their knee replacement, and it basically just helps decrease the amount of opioid use after their surgery.
Yes, sir. And for your patients, how has this benefited them?
This has been really helpful primarily just because, I've had a number of patients where they've had difficulty ambulating or walking because of knee pain, and so after doing this procedure, it's dropped their pain level, for example, from let's say an 8 out of 10 severity to maybe a 2 or 3 out of 10. Often we can get them lower. It just kind of depends on how mobile they are, but being able to calm someone's pain down more to help them be more active in their daily lifestyles has been very helpful.
Yes, sir. So, what makes this product stand out compared to their competitors?
The biggest thing that I like about this is it gives patients more control over their care, and so there are certain situations where this may not be a good choice for you, and so certain things, if you have a very intense cold sensitivity, some people have what's called Raynaud's phenomenon, where cold temperatures can decrease blood flow to their fingertips or their toes. And so if you have a really bad cold sensitivity, I would not recommend necessarily considering this device as a first choice, but it's definitely been helpful for a number of different patients. This has been helpful for a lot of different peripheral joint pains, and so like I said, shoulders and knees in particular have been helpful. No steroid use with this machine. Some people have done alternatives like viscosupplementation, where they're doing lubricant injections for knee pain, and often patients get frustrated just because they've tried a number of things and they're kind of running out of options and they feel pressured to do surgery. And so this is just a different option for them that may be a good choice for you depending on your conversations with your doctor.
Yes, sir. And what does it mean for you to be able to offer something like this for help people relieve their pain?
It's been a blessing. So, working with the Orthopedic and Sports Medicine Institute for the last almost 2 years now, I've been very blessed to help a lot of people with different procedures that I've offered. And so we started using this device back in July of last year, but it's been out for about 10 years. And so there's quite a bit of data showing that it's been helpful for people. In particular for me, I've done this about 100 times. There's only been 2 instances where the cold sensitivity was uncomfortable for the patient, and so one of those situations we had to discontinue discontinue the procedure a bit early. So, in good faith, I did want to let you know that, this has been helpful for a lot of patients. But there are some patients where if they have a pinched nerve in their neck or their back that are radiating into their shoulder or knee, respectively, this procedure has shown to kind of exacerbate some nerve-related pains, but for the vast majority of arthritis specifically, it's been very helpful.
Alrighty, thank you so much for coming in and telling us all about that. For more information, you can get to that website right here on your screen.
Yes, thank you so much.